which is not a contraindication to IO access. A. Fracture at the site. B. Overlying infection at the site. C. Previous attempt at the site. D. Fused growth plate at the site. D. Fused growth plates are not a contraindication to IO access. IO access should not be attempted in the setting of a fracture of the bone, those with fragile bones, that is osteogenesis imperfecta, if there is an overlying infection at the site, or if there has been a previous attempt at the same site. IO access can be used in all age groups. Thus, fusion of growth plates does not preclude its use. There are very few absolute contraindications to IO use, most of which are related to anatomic considerations. In most cases, if one bone is disqualified from IO insertion, other insertion sites should be available. In the case of relative contraindications, the benefits of immediate IO access must be weighed against the potential for complications. Current contraindications for intraosseous access include the following. Absolute contraindications: 1. Unhealed fracture or surgical division of the selected bone, allowing extravasation of fluid. 2. History of prior sternotomy for sternal infusions. 3. Active infection at the selected insertion site, for example cellulitis and abscess. 4. Recent IO access attempt at same bone within last 48h. 5. Inability to identify appropriate external landmarks, increased risk of improper placement. 6. Prosthetic bone or joint at selected insertion site. Which of the following drugs cannot be administered via the endotracheal route? A. Lidocaine, epinephrine, vasopressin, amiodarone. D. Amiodarone cannot be given via the endotracheal route. Lipid-soluble medications such as lidocaine, epinephrine, atropine, naloxone, lean, and vasopressin can be given via the endotracheal route. The best place to check for an infant's pulse is A. The femoral artery in the upper leg, B. The brachial artery in the upper arm, C. The carotid artery on the side of the neck, D. The radial artery on the thumb side of the wrist. The best place to check for an infant's pulse is the brachial artery in the upper arm. All your answers are very impressive and focused. Excellent.